You know, in the high-stakes world of pharmaceuticals, compliance isn't just some department down the hall. It's your actual license to operate. One wrong move, just one little misstep, can mean recalls, massive fines, and a starring role on the FDA's wall of shame. So let's dive into what happens when the paperwork looks okay, but the science behind it is just completely wrong.
Look, almost every company has a thick validation protocol binder sitting on a shelf somewhere, right? But here's the reality check. The FDA isn't just looking for your template. They couldn't care less about the binder. What they're looking for is hard, defensible, scientific proof that your process works every single time. It is all about the data, not just the document.
I want you to think about that number for a second. 1/3. A full third of all lab-related citations are for this exact issue. So this isn't some rare one-off mistake. It's a huge systemic problem across the industry. And to really get our heads around it, we're going to deconstruct a real-world case, a warning letter from February 2023 that shows us exactly how these things fall apart.
Okay, so let's get into the anatomy of this particular failure. We're going to look at the very first citation in the letter, which immediately goes after the company's justification for their equipment. This is where the whole story really starts to unravel.
So the company tried to use something called a bracketing strategy. Now this is a totally common and acceptable approach if you do it right. The idea is pretty simple. If you can prove your process works perfectly at its smallest and largest limits, you can then scientifically say it'll work for everything in between. Makes sense, right?
So here's where their gamble just went completely off the rails. On the surface, it looks fine. They tested a 100 milliliter fill and a 500 milliliter fill. But, and this is a huge but, the FDA pointed out a fatal flaw. The products they were testing had totally different physical properties. And it gets worse. During the actual validation run, the machine failed its fill weight test. That's the test that makes sure every single bottle has the right amount of product. And what did the company do? They just ignored it, pushed right ahead to commercial production anyway. This wasn't a gap in their validation, it was a total bet, and man, they lost big time.
So the thing is, this wasn't just one mistake. An error this big points to much deeper, systemic problems. To really understand why this happened, we've got to look at the root causes, which we can boil down to what I'm calling the 3 deadly sins of validation. These 3 sins are basically a roadmap to getting a warning letter. First, you've got a bracketing strategy that was just fundamentally flawed. Second, a company culture that let people ignore critical test failures. And third, a cleaning validation that was, well, basically a work of fiction. Let's break each one of these down. Okay, first, that bracketing strategy. You just can't test a product that flows like water and then claim it validates a product that flows like honey. It's common sense. The different densities and viscosities put completely different stresses on the equipment. If you're going to do that, you need an incredibly robust scientific rationale explaining why those differences don't matter, which of course they didn't have. So the whole thing was scientifically baseless from the start. This second sin, this one tells you everything you need to know about the company culture. When the equipment failed a key test during the validation run, that data was just swept under the rug. Why? Because they had a deadline to meet. This shows a culture that values the go-live date way more than the data integrity date. And for an FDA inspector, that is a massive red flag. It tells them that at your company, data integrity is basically optional.
And this third sin is, well, it's almost hard to believe. For their cleaning validation, they didn't even use the right piece of equipment. The study was done on a completely different tank. It was made of different materials, it had a different shape. I mean, the results were completely and totally irrelevant to their actual production process.
And this just says it all, doesn't it? The company's whole approach was like trying to prove you know how to detail a Ferrari by going out and washing a Ford. The equipment, the surfaces, the challenges, they're not even in the same universe. It's a scientifically ridiculous comparison, and the FDA saw right through it. Okay, so we've all seen the train wreck. The question now is, how do you make absolutely sure this doesn't happen to you? Let's build a playbook right now for creating a validation program that's not just paperwork, but is truly defensible. Here are 3 steps that are absolutely critical. First, science first, template second. Your validation plan has to come from a risk assessment of your current process, not some dusty old template you've been using for years. Second, justify the why. For everything. An inspector is going to ask why you chose 10 samples and not 20, or why you set that specific limit. You need a written, scientific reason for every single decision. And third, and this is huge, audit your partners like your job depends on it. When you audit a CMO, don't just glance at their summary report.
Ask to see the deviation logs. Demand the calibration records for the exact equipment used. Get the schematics and confirm the geometry of their tanks. You have to be skeptical.
And I really can't say this loudly enough. Under U.S. law, you, the owner of the drug, are ultimately responsible. A failure at your CMO doesn't just put their business at risk, it puts your product license on the line. Their failure becomes your warning letter. So yeah, you audit them as if your job depends on it, because it absolutely does.
So when you boil it all down, this really becomes a mandate for leadership. It's about changing the whole company's mindset. You have to stop seeing compliance as a binder of documents and start seeing it as a coherent, defensible story that you can tell.
Look, the goal these days isn't to be perfect. Processes have issues, things happen. The goal is to be defensible. It's about having a rigorous scientific story that proves to an inspector that you understand your process, you control your risks, and you make sure your product is safe, period.
So I'm going to leave you with this one question to take back to your team, to your next meeting. Is your validation program just a binder, collecting dust on a shelf, filled with old templates and checked boxes? Or is it a living, breathing, defensible scientific story that you can stand behind with 100% confidence? Because honestly, the answer to that question could make all the difference.